This is specifically for Board of Education members across our state of North Carolina. I'm Dr. Lori Langdon, a board-certified pediatrician, mother of 6, and member of the North Carolina Pediatric Society. We are 2,300 pediatricians strong across this great state, and it turns out we all agree on today's topic. So why should you listen to me? Because I love children. I am an expert as a pediatrician in children's health in all areas, and I'm passionate about protecting children. So I see patients in my local county, and so these decisions by the local Board of Education impact my patients and thereby my patients' families. That's why I care passionately. Also, I care because my daughter is a teacher in the local school system. And so I also want to protect her and the other school staff. So for my personal local Board of Education, I have written you a detailed letter. It was never acknowledged, so I'm not sure that you got the details on it. So I genuinely want to kindly share what information was in there. And if I can be of service or consultation to help you make some of these difficult decisions, please contact me. I'm always available for that sort of thing. There are also many resources in many rural counties across our state, particularly local health departments, that are happy to give you numbers of recent positive cases, local hospitals that are happy to give you numbers of hospitalizations. So these are the reasons I would love for you to listen to me, and I want to try to make 3 quick and easy to understand points about why I passionately currently support the use of masks in public schools. So, number 1, they work. This is awesome. So the very best study we have to date that is recent and relevant is the ABC Science Collaborative. In fact, if you need to pause this video in a moment and look this up, I would highly encourage you to do so. Or if you are watching this on a computer and you can look this up on your phone, please feel free. All you have to do is Google the ABC Science Collaborative. That will bring up their website, and then you can look at the ABCs of North Carolina's Plan A, and that will outline their findings. This was based on National Institutes of Health grant, an NIH grant. It was co-chaired by 2 pediatricians from Duke University, Katricia Zimmerman and Danny Benjamin. I went to all 3 years of residency with Danny Benjamin. He's pediatric infectious diseases, and she is critical care at Duke School of Medicine. They also combine with UNC School of Medicine, and they actually looked at, from March to June of 2021, all of the elementary, middle, and high schools in North Carolina who were practicing Plan A. That is full 5-day-a-week attendance in school with mask wearing. And they evaluated in-school transmission rates and found that universal masking could curb transmission of the COVID-19 virus to 1 in 3,000. That is phenomenal, that is encouraging, and that is exciting. So we have real-time, real-life data documenting and proving the efficacy of the use of universal masking in a public school setting to make school settings safe, to make it okay to go back to full-time face-to-face instruction as long as these recommendations are followed. And that's partially where we get a lot of our recommendations in the current toolkits we use to get kids back in face-to-face instruction in public school are based from this study. So I would encourage you to Google that, look it up, see the data, see the study, see their recommendations. The really neat part is, with the use of universal masking, we were even able, based on these recommendations, to decrease some of the additional measures. This study recommended that children be allowed to seat 3 to a seat in school buses, that school buses be allowed to operate at their routine capacity. So this study isn't just a restrictive or a bad or you have to do this. It actually opens up some things based on the level of protection afforded by the masks. Now, you may say, but wait, was that in the time of Delta variant? Possibly not. It seems to have surged more over the summer. As you know, the Delta variant's more transmissible. So would it seem a wise idea to you, if we're dealing with a virus that's now become even more infectious, that we back off and use less protective measures? That would make no sense at all. So the reason, number 1, I'm passionate about mask use in public school settings is it works. We have proof that it works. Reason number 2, I genuinely care about your children and your students and my patients. Your students are my patients, and I really want to protect them. We have seen an increase in hospitalizations in children from COVID-19 during this surge of Delta. That has primarily been driven by outbreaks in children in states with low vaccination levels. Hate to break it to you, but North Carolina is not in the top for vaccination levels. And oh my goodness, my personal local county is near the absolute bottom of an already low state. So when you have an environment of multiple contacts who have no protection or pre-made antibodies against the virus, this is ripe breeding ground for the virus to go crazy and infect lots and lots of people. So here's what happens, and this is exactly what is currently happening in my local county. We have a total of, I've been told, 15 ventilators between the hospitals in this county, and many times 14 ventilators have been in use. I think that 15th one is even like an emergency backup thing. So there have been cases of patients who needed to go on the vent and had to wait their turn and stay on BiPAP because they were waiting their turn on the ventilator. This is just reality. You can have patients in small community hospitals who need to be transferred to a higher level care, like a trauma center or a hospital that offers additional things that we may not have in a local poorly resourced rural county. And those hospitals, the ones with the trauma centers and things, can't take the referrals because they're full. They're either max capacity of patients altogether or their ICU beds are full because of the surge of inpatient COVID. So you know everything changes minute to minute with this COVID pandemic. Well, today I'm making this recording on Wednesday, September 15th, 2021. And I just got an email. The number of inpatient beds used right now for COVID-19 patients in the entire state of North Carolina increased 60 overnight. Okay, so everybody was hoping we were about to reach the peak and then start to decline from this Delta surge, but we're not there yet, I'm sorry to tell you. 60 additional inpatient admissions for COVID-19 patients. This is a concern. In fact, the latest study that looked at this found that 1 out of 4 ICUs are at greater than 95th percentile or 95% full. They're at capacity. That's 1 out of 4, and that's up from 1 out of 5. This is primarily in southern states, which is where we are in North Carolina. When our ICUs are full, care has to be triaged, and that's terrifying if you don't understand. That means if you're in a car wreck, all the trauma beds are full. Sorry. That means if you need to go to the emergency department for a heart attack, oh, the ER beds are all full. Sorry. It really impacts our entire community, and I'm not sure people understand that if we start getting outbreaks and clusters of COVID-19 infections in school children, and they go home and infect their grandparents, and the grandparents have to be admitted or need ICU care, it won't be available because the hospitals are full. So I need everyone to understand these decisions about public education impact our entire community, and never have I appreciated as much as recently how much this pandemic affects every level of our society. The hospital capacity matters. So when we can decrease transmission of the virus in the school setting, this helps not only the children not to be sick and get admitted, which is happening now, it helps their families not to get sick and be admitted. It helps to not overwhelm the entire healthcare system. And this is critical, guys. I hope you understand that. To wear a mask is to be compassionate to the other person and to protect them. And we have children in our public school systems who have leukemia, who have severe asthma and are on chronic inhaled steroids or chronic oral steroids, or have ulcerative colitis or Crohn's disease and have to take prolonged courses of steroids that suppress their immune system. Please remember that your child's mask protects the other children. Universal masking works because everyone is protected. Parents' choice masking doesn't work because everyone is not protected, and it leaves so many children vulnerable. When you say parents' choice and I want my child to wear a mask, that only protects your children from my child's germs. It doesn't protect my child. My child is protected when your child wears their mask. I hope that makes sense and you can understand that. Okay, so that's number 2 reason. I want to protect your child, the family, and the community. Here's the number 3 reason that I really want to wear masks in school. I want your children to stay in school. I want for your child to receive the highest quality form of education, which is face-to-face instruction. That's also what the American Academy of Pediatrics and the North Carolina Pediatric Society want. We want your child to be around a loving, caring adult. We want your child to receive a quality education, to have the socialization skills that come from being around other children, to have playtime outdoors on the playground, to have guaranteed warm meals if they need it. This matters a lot in rural areas. So you can see why I'm concerned that in an under-resourced, poor rural area, these children may need breakfast, they may need lunch, and they're not going to get it if we have to revert back to virtual education. Virtual education is not a good option. And if there's a teacher in a child's life who could recognize signs of abuse or neglect and notify the appropriate authorities like Children's Protective Services, that's a huge service to that particular child who may need some intervention. So you can understand why, as healthcare experts for children, we want these children to stay in class. Also, many children are not typically developed. They may need the resources of physical therapy, occupational therapy, or speech therapy that they're able to receive when school is face-to-face, but they're not able to receive when school is virtual. So when we're thinking about the welfare of the entire community, the welfare of individual children who are perhaps developmentally delayed or have special needs, the welfare of children who are immunocompromised or might have family members who are, universal masking is our only choice. And I have heard from local school districts that our local Board of Education that they are trying to follow the recommendations from the North Carolina Department of Public Health, which is called the Strong Schools NC Public Health Toolkit. Well, you can't actually be following that and get rid of the mask mandate because it clearly states that all schools should require all children and staff in K through 12 grades to wear face coverings consistently when indoors. So once you opt out of the public health guidelines for the entire state, you can't claim to be following them because you no longer are. So I hope to do another video on some myths around mask wearing, and I want to encourage people to actually follow guidelines of experts. It's no accident that all the experts agree on this, guys. And so if you are caving to political pressure from parents who are selfish enough to not want their child to protect the other children in their classroom, that's really sad, because your job when you're elected to the Board of Education is to protect the health and well-being and welfare of both your students and your staff, and you failed to do that at this time when you get rid of the mask mandate. Please remember, we're not going to be this passionate and pushing the mask mandate when our numbers are improved, when our hospitals are not overwhelmed, when the ICUs are not at maximum capacity with every single ventilator being used that we have in this county. So understand that we're reasonable people. We just want to protect the children and believe strongly that that's what you were elected to do.